So let's take the hypothetical emergence of a new disease somewhere in the world. Now, under the system in which WHO is strong, and we're part of that system, data that suggests a spike in new fevers and a respiratory illness among a couple hospitals in this one area of the country, that would be alerted to the local WHO office, country level office, go up to the regional office. There would be an assessment whether this seems out of the ordinary. If so, advice would be provided to the country about what sort of diagnostics might be employed to identify the cause of that outbreak. There might be some sort of capacity sent to the country, whether it's people to help advise or equipment to make diagnoses. And pretty quickly, hopefully, we would be able to identify, is this a virus or a bacteria? If it's a virus, is it a common virus that's just changed? Or maybe it's just a seasonal abnormality or pattern that we haven't seen before? Or is this something new? It's a threat. It's an emerging disease. That would all happen, and those data would be shared up the chain all the way centrally to WHO and then shared with the member states. There'd also be a discussion involving those member states about whether that's a threat, what kind of a threat it is, what sort of response that should be. And currently, the US plays a critical role in all stages of that, in assessing the threat, evaluating whether a response is warranted, what it should be, and then helping to organize that. Now let's take a step back and say we're no longer part of WHO. This disease emerges. The same thing happens. We have no idea. There's no communication that anything's happening. The US has no visibility. We have no access to the data. At some point, maybe people in this system decide it's not a threat. We've had no voice into whether we agree it's not a threat. We don't hear anything about it until, boom, all of a sudden it was a huge threat. It's too late. Or let's say that they decide it is a threat and they start mobilizing all sorts of resources. Well, maybe we didn't believe it was a threat. Let's say that they do think potentially it's a threat. We have no voice in what the response should be, how containment should happen, what sorts of, air travel restrictions might happen, what sorts of treatment strategies might be employed. We're not part of that discussion. We have no access to the data. We don't have access to the sequences of the actual pathogen to help us develop, a response in terms of vaccines or otherwise. All of that now becomes a black box. And people say, well, can't we still have country to country engagement? Certainly we would do that. Well, it depends. Is that a friendly country? Or is that not a friendly country? Is that a country in which we have active collaborations that are going to be part of discussion or not? I mean, do we really want a system that's dependent on whether or not we like you and whether you like us in terms of our ability to collaborate on something of global importance like a potential pandemic? And that's really what we're talking about, is the potential for the inability to be part of that decision-making process and understand what's happening in the world around us.